Alors, the city who works with us. Do you see the France?
Yes,
Paris.
yes.
Okay. In Paris, there was very few people worked with me in Paris. Saint-Louis, no. Henri Mondor, no. I don't know. Lille. Lille is a city of the north of France. Lille. I will see where is Lille. Arras. It is between Arras and Bruxelles, but it is in France. Oh, Lille, c'est pas possible que ça soit pas là. Lille. C'est pas possible. No. Lille.
Okay.
What we
Northern France.
Yes. No, it is in France. Huh?
Okay.
Okay. Lille work with us. Lille, it's okay. Caen in the city in Bretagne. Caen, Évreux. Caen work with us.
CAE.
Yes. Brest is here. Brest, c'est Brest. Just at the end of the Brest. BRST. Nantes here. Okay. Nantes.
I have it.
Regarde, Strasbourg, j'ai oublié. Strasbourg is a very important city in France. Lyon, no. Poitiers, work with us. Poitiers. Sometimes, I think it's so. Poitiers, excuse me. Poitiers, where is it? Poitiers, here, you see?
Yeah.
Yeah.
Okay.
Dijon. Côte d'Or. Dijon, here. Marseille. Nice. Bordeaux, c'est pas une cité bataillonne. Toulouse. C'est tout Toulouse. C'est par là. Bordeaux. Toulouse. Là. Toulouse.
Okay.
This city here. Toulouse. I think it's all. But I will find the papers, and of course, you have to give the name of all the participants, and
Yeah.
you'll see their name,
Okay.
because they are also. And you have a meeting for our group.
Back of the camera.
Une fois par an, one for each year we have a meeting in Paris. Or elsewhere. No, in Paris. We have a meeting to see exactly where we are and new idea for new protocols, if we can obtain some other drugs and so on, you see. But at the time, the treatment was chlorambucil, was COP, shot, and it's so. And we participated to the protocol which published in New England Journal of Medicine, but it was not a good paper, of immunoglobulins, you see. They tried to treat all the patients with intravenous immunoglobulin. And they said, but it's not true. There is good result for CLL2. It was not true. There are good results for infection because there are no more. There are the number of infections diminished, but it's so. Okay.
I think that's good.
Who would you say has taken up your work, or who comes after you for CLL?
Now, exactly the same group, but the chief of the group is Véronique Leblond. I will write his name, Véronique Leblond. She published now very much. And she's now she's the director of the Department of Hematology at Pitié-Salpêtrière. And Mère Lebéral works for CLL in terms of lab in Pitié-Salpêtrière too.
Okay, and another area that I wanted to mention was if you would talk a little bit about your relationship with Jean Bernard.
Oh, very good one. No, but it is personal.
Oh, okay.
Personal good one, because I was perhaps I gave a book on this. No, stay. I have a book for. You understand French?
Oh,
I will give you.
Okay, thank you.
And I give you a book too for the Academy. In English. I have the book in English for the French Academy. It is a place where we are. It is for you.
This is good. This is good.
Jean Bernard, you see, was my teacher. So when was young, I worked like extern. Extern is the students. After I was resident.
Sure.
After I become chef de clinique. Chef de clinique in English means senior. And after I become professor agrégé with him in Saint-Louis. But in 68, there was a real revolution in France. And because before 68, in Paris, there was only one school of medicine of all the Paris. And they founded at this time 12. We go from 1 to 12. It was crazy. School of medicine. So at this time, I leave Jean Bernard, and at this time I went to Pitié-Salpêtrière, and I created there a department of hematology in 69. And after I got moved, I stay all the time. But I have always very good personal relation with Jean Bernard. And because just every time. Because once he's retired, at first Jean Bernard was the first hematologist in France. And everybody tried to work with Jean Bernard.
Yes.
But once he retired, nobody went to see him. And I was alone to see him, not very often, but once every 2 or 3 months. He lived near Jardin du Luxembourg, Rue d'Assas, and I have an appointment always Sunday morning at 12. So we speak together during, and he went in my department in Pitié-Salpêtrière. I forget. Every week when he retired, he went in my department, and he went we have a seminar, and he was always at the seminar. So I was very and he was a very good friend of other hematologists, was Marcel Bessis, very good cytologist. And I was always very near to Jean Bernard and Marcel Bessis. And at the end of Jean Bernard, it was bad because nobody liked to see him except myself. And a Belgian, who is Jacques-Louis Binet, who worked with us at this time. And Jacques-Louis Binet came very often from Brussels to see Jean Bernard.
Recently, just yesterday, in a rare bookstore, how do you say, ancient?
Antique.
Antigua bookstore, I saw a book, the illustrated history of hematology by Jean Bernard, Marcel, and yourself.
It is not a good book. I can tell you because why? Anyway, we give some paper, but it is not a real entity. You see, okay. You have to work very much. But Jean Bernard liked to write too quick. He said, no, it's finished. You have to publish in short time. It was crazy. Because in France, at this time, there were many things to say, to see in the story of hematology, you see. And do you know the polyglobular? You are a hematologist, of course.
Yes.
Bon. You know polycythemia.
Yes.
You know in France, but I will see a picture and the other floor, because in France, polycythemia was described by a physician who called Vaquez. Vaquez was a specialist of heart, and he see many thromboses, he see cyanosis, were not explained by problem of heart and lungs. And he published them. This is very astonishing. Sometimes you can see cyanosis. At this time, we count, but it was the start to count the number of red cells. You see, so you see sometimes you see cyanosis and not problem in lungs, and of course a patient died, and he make autopsy, and he said always lung normal, heart normal, but enlargement of spleen, and it was at the end of the last century, you see. I don't know, he says that because he cannot prove. So bone marrow is very active. It was genius, but he cannot prove. It is very active. And this spine, many hematologists don't know from where comes the blood cells. And bone marrow was not sure it was a good place, you see. And he said, I will show you at the first floor with a picture, we see Vaquez. And Vaquez was the first French, because in 1923, and you can see the reference in this book, I think, was founded the French Society of Hematology, and Vaquez was the first president. He was not real hematologist, but he described polyglobuli, and in French we call Vaquez disease. You don't see polycythemia. Very often we say, and he described, because he sees cyanosis, enlargement of spleen, thrombosis, and heart and lungs normal. It was the symptoms of the disease.
I was not aware that two platelet disorders were named after Bernard. Bernard-Soulier syndrome?
Bernard-Soulier. It was a disease of platelets.
Yes.
Yes. But I was not at all involved.
Yes.
It was before I become
Okay.
into the, but at this time, Jean-Bernard made everything. And it was a real entity. But in front, Jean-Bernard was a man who organized hematology.
Yes.
And he were very much, when he became chief of department, the director of hospital said him, we have not to take in your service children with leukemia, because they will die in 2 or 3 days. Jean-Bernard was the first to say no. I have to take in my department. You say, it was in 46 at this time. Nobody works on leukemia. And he made very active protocol for acute leukemia. Yeah.
He also
With Jacques-Louis, but Jacques-Louis died.
He also has a textbook of hematology or a textbook on leukemia.
Many, but very bad. One during the war. During the war, he was resistant. He was against the German people. Though he was in the country alone, and he worked like this, a book of hematology, 2 kinds of hematology disease. One, we know exactly the origin, and many we know nothing of the origin. It was a very bad book. And after, they are not too good. After we use your book, we use the American book.
The reason I ask is that sometimes in the history of CLL, at least in the U.S., they use Sir William Osler's textbook of medicine, which was some 9 or 10 editions, and
9 editions, yes.
But there are like 2 pages on CLL, and so I was trying to find the equivalent textbook of hematology.
But it is the textbook of Jean-Bernard.
Yes, that's what I'm thinking.
But it's not a good text.
But it is a historical point in time.
Yeah. I don't know where you can find it. Perhaps you can go with me to the library and see of the
Here?
the library.
That's an excellent idea.
We're
Yes.
going there. Okay.
Very good. Excellent.
Okay.